Thank you very much. My name is Julia Bello-Bravo. I am originally from Spain, so you will hear my Spanish accent. I hope you understand me. If you don't understand, sorry. I will try to speak slow because I think it's better. So I am presenting today a program that I am one of the co-founders. It's called, like he mentioned, a great name, Scientific Animation Without Borders. And I have to say that the name came after Medical Doctor Without Frontiers and also the Translator Without Borders. So we thought that scientific animation was a great name, right? It resonates with people. So educational animations to address global health challenges. This is the title of my presentation. And I have to share a good news for our program. So far, SAWBO, and I will pronounce Suavo, but other people say SAWBO. So SAWBO touched 43 million people globally as of December 2019. So this was a great Christmas present for us. So what is SAWBO? SAWBO is a program based at Michigan State University. And we create educational animations, translate into local languages, and deploy through mobile phones or any other electronic devices. So why do we do animations? So we do animations because there are like up to 800 million people that don't have access to information and knowledge, that live in rural areas, that speak many different languages, and they still have mobile phones. So I think it's important to create educational content for these people and take advantage of the mobile phones so they can access this information. And again, the way we do is we create animations, translate into local languages, and deploy through mobile phones. Our mission statement is facilitating access to life-improving scientific knowledge and health-related content to people of all literacy levels in their own local languages. So this is our mission statement, but we focus mainly on people that cannot read or write. But of course, we also work on people of all literacy levels because sometimes, we can read and write, we are very well educated, but we don't know anything about a disease. Like yesterday about, the Mona disease, I didn't know anything. So in that disease, I am a low literacy learner, right? So this is our mission statement. And the strategy, again, we are an academic program. We work with a team of experts. We create content, but we don't decide on the content. So we work with medical doctors, we work with people that really know the content to create this animation. So this is more like a peer review approach to animation. So we don't just create animation on any topic, like we look for the experts that help us to create animations. And then we share the animations, with many people, placed into many different languages. And, the animations, we don't scale, we don't deploy the animation, but we have like many different partners around different countries that will use these animations in their educational programs, and they will be the one scaling this animation. And in the bottom, you can see our framework. So the first one are the experts. There are global and local experts. Then they help us to create the content. Then there are other people that scale the content, and then we benefit the end users. And the end users is people, like I say, that live in rural areas, that speak many different languages, and they don't have access to information like we do. So this is expert-driven content. Again, we work virtually with many different groups, but sometimes we also go to different countries and we see how these animations are used in educational programs, in trainings, in capacity building, so we kind of follow up. And we work with volunteers to translate this animation. So we pay the animators. We don't make the animations ourselves, but we pay professional animators. But then for the language, for the translation, we work with volunteers from different countries who speak English or French or Spanish or Portuguese, and they also speak other local languages, so they help us with the translation, the recording, and then we give them attribution. At the end of the video, we put their names. And also when they deploy this video, their name is in the video, so you hear the name of the volunteer. Again, this is the translating content. We have also worked with Translators Without Borders, and they also help us on very specific topic, like for example, the Ebola. They help us to translate the Ebola animation, but we don't use them all the time because they are a little slow, right? So volunteers are very fast. So what we have is a growing library of animations that is constantly growing, because when we have a new animation, these go into the website, and also we have an educational app, so it goes into the app. So we have around 90 topics and more than 145 languages. So the language is really, we are very strong on local languages. And I have to say that our core areas are agriculture, health, women empowerment, and peace and justice. So we don't focus only on health, but we have a big component on health, and this is why I am here today. And this is our website. You can see, different animations on, Ebola, cancer screening, malaria, dengue, many. I invite you to go to our website and watch these animations. We have like a series of TV, and if you are working on tuberculosis, but this is very good tool to use, right? So again, like I say, we are very strong in languages because people want to get to hear the message in the language that they feel most comfortable with, right? I am comfortable speaking English, but if I can speak Spanish, then I am better. So it's the same, right? People want to hear the information in their local language. So this is some pictures of women watching animations in Niger, and I just think that it's a beautiful picture because women, there is like disparities in gender. So anyway, so more than 100 countries have been using our animations, and anybody can use these animations for educational purposes. They are free. Once they are created, they are ready for everybody that wants to use. And, if you, again, if you have a program and want to use our animations, please contact me. I can share like a high quality animations. We work with TV stations in different countries. We work with large NGOs, mid-sized NGOs, small NGOs. We work with the public and the private sector. So we have like a very broad diversity of partners around the different countries. And also I think it is very important to engage youth, right, in the use of these animations. So we care that to be inclusive, to really, again, our target audience are people in rural areas, but youth are the one that knows about technology. They know how to use mobile phones. They know how to share animations. They are very savvy. So we really engage youth in different communities to help us to deploy this information. So again, one of the challenges and opportunities for this program is how can we create scientifically accurate content, right? because we are talking about diseases, and we need is not like what we want, but it's like what scientifically is proven that is effective. Also, how can we make this useful for everybody, right? But for people that are like low literacy learners that need something very visually, they need to see something that speak many different languages, that come from different cultures, and also, again, gender, age, there are like many different factors that we need to keep into consideration. And how we can engage the global community, right, to scale this content. Because again, we create animations, we do research with animations, but we cannot scale, go to 100 countries or more and scale this content. So how can, as the global community, come together and scale this information that can be useful? And so what are also the uses and the outcome of this content? So it's not about producing videos, it's not about creating animations, but also knowing how these animations benefit people's life, how they change, their daily life, improving their daily life. So these are challenges and opportunities. And like I mentioned before, we do research with this animation because we want to see the impact. So one of the questions that we have at the beginning of when we started this program in 2011 is, can people learn by animations, and if they are willing to learn in this way? And the answer is yes. We have done like different research studies in different African countries, and we realized that people enjoy animation. Animations are not just for children, they are for adults. And people are willing to watch animations, and they are learning, with animations. And this is just one example of a research study that we did in Mozambique. So there was a pre-treatment and a post-treatment. Everybody at the beginning knew have the same knowledge, and then at the end, we compare animation with extension presentation. And then at the end, there was like increased learning gains in people that watch the animation only. But animations are more effective if there is like a facilitator. So if you have like an educational program with a facilitator that explain the content, that can ask questions, can answer questions, then people, the increased learning gains goes up. And also we want to know the second question, research question that we have is what people do with this information. Really? Do they change their behavior? Do they adopt the technique that we are providing to them? And this is another research that we did, and there was like 89% adoption rate after 2 years of having this program in the country. And not only that, but people also share the animations with other users. So probably more people are doing the technique that we are providing in the animation. So again, this is a collaborative model. We work virtually and to place this content into many different languages. So if you speak other languages and you want to volunteer, I invite you. I will be very happy. The content is free for everybody, and we have like a deployment pathways. Like I mentioned before, we work with many different partners, and we have like online and offline platforms. We work with TV stations, and we also have an app. And I will be, this afternoon, I will be presenting on how to use the app. It's an educational app. It's called the SAWBO Deployer app that allow you to look for information based on topic, language, and countries. When you have internet access, you can download information. And then when you don't have internet, it will stay in your phone. So then when you go to a rural area, you can share with any other phone, right, if they have Bluetooth technology. So this is called the SAWBO Deployer app. And like I mentioned before, we engage students, we engage youth, And this is in in Kenya. And there was a group of students that put the lyrics into the malaria animation, and it's beautiful. And I just want you to listen, like, very quickly. How do I? For the music, yes.
Yeah, I think you press the
Here.
It's embedded, yeah.
Yes. Just a little.
Malaria, Jujikinga Bedia, malaria, malaria.
So it's English and Swahili. Their voices are beautiful. They were very successful. They went to many different radio programs. People in Kenya listened to them. It was amazing. So again, this video is in our website. So if you want to hear the whole song, it's really worth it. Beautiful. Okay now. So we are seeking for new partnership. This is why I am here. And we are seeking for people to use this content, and together with your programs, we can add another zero. Like I mentioned before, we have 43 million, so with your help, we can go to 430 millions. And millions have and can use animations created by SAWBO. Thank you very much, but before we go, I want you to see one animation so you can see is dengue, because yesterday there was like different presentations about dengue, so just like a short animation about dengue. And thank you. This is our website.
Dengue is a disease caused by a virus that is transmitted to people through the bite of the female Aedes mosquitoes. The important species are Aedes aegypti and Aedes albopictus. The symptoms of this disease may be similar to those of the flu and include high fever, headache, red spots on the skin, and extreme tiredness. Bleeding from the nose and gums may also occur. In the presence of these symptoms, you should not take any medication containing ibuprofen or aspirin, since these medications can increase the chance of hemorrhage. You need to go immediately to the nearest medical center. To prevent the infection, you should avoid being bitten by the dengue mosquito. The mosquito bites mainly in the morning and shortly before dark. It lives no more than 100 yards away from where it was hatched. They usually hide in dark areas behind plants and shrubs. Indoors, they can hide under beds, behind curtains, or in the bathrooms. At home, you can be protected by placing metal or plastic screens in doors and windows. Keep doors and windows closed. Install bed nets around the beds and sleeping areas, following correct instructions. You can also use battery or electric diffusers with pads impregnated with insecticides and insecticide sprays. When performing tasks outside your house, you can protect yourself by wearing socks, long pants, and long-sleeve shirts, preferably light-colored. You can also apply repellents on exposed areas on your skin. Environmental sanitation around the home is more effective when performed together with our neighbors and the community. Environmental sanitation may consist of 1. Avoiding the accumulation of stagnant water around homes where mosquitoes can breed. 2. Removing car tires that are not in use. 3. Picking up trash and placing it in bags or in tightly closed containers until collection service can take it away. If this service is not available, you can also burn or bury the trash. 4. Removing empty bottles and other containers that can hold water, or placing them face down so they do not hold water. 5. Changing the water in bird baths and flower pots on a regular basis. 6. Cleaning roof gutters that may serve as water reservoirs. 7. Placing sand under potted plants. 8. Applying chlorine in swimming pools to prevent mosquitoes from laying eggs. 9. Ensuring that clean water tanks for human consumption are tightly closed. 10. Mowing lawns regularly. Let's all work together to stop the spread of dengue.